Live from New York. It's Thursday morning. I am your host, Lou Bernardi. This is Benefits with Friends. Thanks for joining us today. We have a great guest today. I'm going to keep in the waiting room a little bit longer than normal because he's a fan of the New Jersey Devils. Sorry, and I'm a huge Ranger fan, so we need him to suffer a little bit because they're a little ahead of us in the standings. Brian Del Savio from New Benefits is going to join us today, and today's I think a real important show because, as you know, if you've watched this show before, I'm a benefits advisor. Essentially, people affectionately call me Boo because I like to think of myself as a benefits optimization officer. And, I'm very conscious myself of the fact that over the last 25 years, benefits have really been watered down. And what that means is, people are walking around with ID cards, insurance cards, if they're lucky to be insured. But those benefits, the underlying benefits of a lot of group health insurance plans have really high deductibles these days, out-of-pocket costs that make accessing care hard, difficult for people, and especially when they're the most vulnerable. And so there's a gaping hole for a lot of really important services that can be offered in a non-insurance way through technology. The average person, I think, just as of yesterday, the average person spends about 3 hours on their mobile devices. Adults, at least an hour. Children, and teenagers and millennials, a lot more often. So, technology can really play a huge, vital role in delivering benefits that people need. So I'm going to bring on. Well, he's been in there longer than most. So let me bring Brian in. So Brian Del Savio, thank you for joining us today from Florida. So I'm assuming it's a lot nicer than it is here in New York.
Sure.
How you doing?
Thanks so much, Lou. Thanks for having me. Let's go Devils.
Yeah. We'll save some time at the end for that conversation, maybe after the regular call. But so Brian is the vice president of sales, a company called New Benefits. He helps employee benefit advisors and employers develop a clear path to success by enhancing benefit plans with innovative, fully customizable, best-in-class benefit and technology solutions. Through their platform, employers and their members have access to 35 plus of the most highly vetted non-insurance enhanced benefit vendors at discounted pricing without having to juggle multiple vendor contracts. And I know, Brian, you and I had a call recently, probably last week. And, there's so many solutions out there. And one of the real challenges that we have as benefit advisors, brokers, boos, and employers have is juggling all of them. Like you mentioned, you can bring these things in, but getting them to communicate with each other, making them easily accessible. I walk around with a password book that's, a lot of people out there might not remember what the yellow pages was because we don't really use that much. But I got 100 or more passwords to various things in my life and professionally. So that to me was one of the more intriguing things, really, what you guys were able to do. So I wanted to let you introduce yourself maybe a little bit more fully, and also introduce the company, New Benefits.
Yeah, sure. Thanks so much, Lou. And I think you hit it spot on. I mean, I think the barriers to entry, you mentioned barriers to entry to providing, real care to employees. There's multiple levels to that. We can talk about that later maybe, but, there's a barrier for the benefit advisor. It's really confusing to vet all these products and solutions. There's a barrier to entry for the HR teams. They don't want to increase their administration. And then there's a barrier to entry for the actual employees, which you mentioned, and their families, because half the time they don't even know where to access these benefits. They have a million different passwords and apps and member portals that they can't even know where to find these solutions, even if they have them, which is really unfortunate. But yeah, I'll introduce myself. My name is Brian Del Savio, Vice President of Sales at New Benefits. New Benefits, like Lou mentioned, we're really an aggregator, an administrator of non-insured benefits. So what that means basically is we obviously don't provide any insurance products, but what we do here is essentially vet all the different non-insured benefits in the marketplace that employees, and obviously therefore their employers, HR teams, are looking for to basically enhance and fill in gaps of whatever existing insurance program or benefit plan they have in place.
Yeah, and that's really for me, that's the key. And one of the things that I loved about your platform is the fact that any size group can work with it. You're not targeting 500 plus, 1,000 plus, 2,000 plus, like a lot of the individual vendors themselves that are even within your platform do, right? We have clients of all sizes, businesses out there are of all sizes, and the one thing I mention this all the time, the one thing they all have in common is it's people, it's families. This type of insurance that we do doesn't just touch employers and employees; it touches their families, right? And we want to make sure that they're well and well taken care of, right? Because one of the big things, one of the big buzzwords, in benefits is absenteeism, right? So you're there, you have someone who's or presenteeism, I should say. You have people that are at work, whether they're working from home or in the office, but they're not really present because they're distracted by something that's happening in their lives or their loved ones' lives. And it doesn't have to just stop at children and spouses. It could be their parents, it could be aunts, it could be uncles, it could really be anything. It could be their pet, and all
Sure.
of these different things. And insurance is a necessity. Insurance has a lot of shortcomings, and I think the data that's out there is really exposing something that I talk about a lot on LinkedIn is the artificial prices and hidden profits. And because of that, the benefit strategies that have existed over especially the last 10 years, have made the access to care really, really difficult. So define for the person who's out there what you mean by non-insured benefits.
Yeah, absolutely. And we're not, non-insured benefits isn't just, one single product or vendor. It's basically an entire category of benefits. So it's kind of weird to describe benefits as what they're not, but sometimes people always assume that we're providing insurance. So
Yeah.
We're not insurance. That's number one. But what they are is exactly what you just mentioned. And that's why I get out of bed every day and do what I do, quite frankly. That's my why, is because hopefully everybody in this industry is looking to provide better access to care, fill in those gaps in those plans. So employees, not just employees like on a sheet employees, actual individuals and their families who are truly struggling, right, to access care and do it in an affordable way, dealing with extreme medical debt. That's what non-insured benefits are here to do. So that could be different for every single group. And it depends on what kind of core plan they have in place. Maybe it's a self-funded, maybe it's RBP, maybe it's a level funded plan, maybe it's a MEC plan, whatever is going on, we can fully customize. And it's important, I think, for employers to realize this and benefit advisors to fully customize benefits around whatever that core, quote unquote, core plan is, to be able to give those members and employees and family members access to care, real care, not $6,000 deductible. Good luck, right? And there's also so many things that aren't covered under insurance, just outright. So I'll answer your question a little bit further, and I'll tell you I'll give you a perfect example of how this affected me and my family about 8 years ago. So that's why I got into the industry. So non-insured benefits, they're things like mental health benefits, virtual access to therapists and psychiatrists at $0 cost, right? I feel like that's, if at all possible, that's essential for individuals and families today. Always has just been a stigma around that. Now it's getting much more accessible, which is so important. So mental health benefits. You mentioned family care benefits like fertility advocacy. Family struggling or couples struggling to start a family could be extremely expensive, typically not covered by insurance. Caregiver support benefits, like every day these employees, like you mentioned, they're showing up to work, they're expected to do their job and their duties. They may be dealing with children at home, young children, aging adults, extended family members dealing with issues, right? It's very hard to juggle all those balls and show up to work and perform and not just be present, presenteeism, actually perform at top level for the company. And then you do have benefits, like you mentioned, pet benefits. I mean, look, veterinarian bills are out of control. I love dogs, but every time I go to the vet, it costs I don't know how it's possible, but $300, $600, it seems like. It's like, oh, I got a bill. This is out of control. So being able to provide access to veterinarians at an affordable rate, and even virtually, believe it or not, is another example of a non-insured benefit. And then you have benefits like that are more familiar to people, obviously telehealth, telemedicine, virtual general medical as well. And then there's even another category of financial benefits like, financial wellness, ID theft protection, legal services, all those things as well. And if you don't mind, should I get into kind of my story and how that actually works?
Yeah, no, absolutely. I think that's important.
Okay. So, I mean, everyone has their story, how they got into the industry. So I grew up in New York, like Lou, born and raised in New York. One of the most expensive places on the face of the earth. I think you can agree to that, Lou.
Oh, yeah.
Crazy taxes, crazy rents, everything like that. I recently switched careers, and I was actually a financial advisor with Guardian Life. And I met them through hockey, like everything else in my life. Hockey has played a big role in my life, by the way. I met my wife through hockey. I actually got into the benefits and insurance industry through hockey as well, because I met Guardian at a job fair before a Devils game at the Prudential Center, which, Lou, I don't think you knew that, but that's the true story.
Wow.
So that's how I made the transition into the industry, which is crazy looking back. But I feel like looking forward, sometimes it's really hard to see things. Looking back, a lot of times there's a plan for things. So anyway, we get married, my wife and I, and we are trying to start a family. And we actually personally were really struggling to do so. At the same time, my wife was experiencing some medical issues that were not covered by insurance. So with these things going on at the same exact time, kind of colliding, me a little bit newer as a financial advisor, working off a straight draw, no commission, straight commissions, no salary, living in New York City area, trying to pay rent, trying to start a family, dealing with that stress. My wife having all these medical issues. We actually racked up medical debt, not $10,000, not $20,000, over $100,000 of medical debt.
Oh.
So there were days, and I didn't really talk about this too much in my past, but now I do because I feel it's important to shed light on this. It was hard to get out of bed, to put my feet on the floor. I looking back on it, it's amazing how we made it through, and I'm grateful for that. But what do? We had to do something. We had to move forward. We couldn't just keep on racking up medical debt. So we actually decided to move to Dallas. There were some providers in the Dallas area. And obviously rents, especially at the time, were probably a third of the cost compared to outside of New York City. So we were able to get a nice little place, kind of hopefully de-stress a little bit, get away from the hustle and bustle of New York, and get some providers and care for my wife and for us. So I was sitting in the Guardian conference room, literally, I think it was my first day there. I was going to keep my block of business that I had started building in New York. And I was going to start building a new block of business in the Dallas area, right? And I started searching at lunchtime in the conference room for things I needed. I needed to find discounts on fertility benefits, right? Infertility providers in the area. I honestly was searching for mental health solutions for me and my wife because it was putting a huge strain on each of us individually and for our marriage. I needed to find discounts on prescriptions or easier access to prescriptions. So anyway, I start searching all these things and new benefits comes up. I had no idea about them, never heard of them before. And I'm like, where is this company located? And they were located, I'm not kidding, Lou, 5 minutes down the road from where I was sitting.
Wow.
So it was just one of those moments in life. I literally packed my bag up, got in the car. I never told the benefits I was coming. And they'll tell you this story too. I just walked in the front door and that's the rest is history. I basically just introduced myself, was able to get a meeting with the HR team. And anyway, that's why I do what I do. But non-insured benefits, to answer your question, is to help people that are going through exactly, employees and their families, exactly what I was going through. And that's kind of my why behind what I do. And that's the why behind non-insured benefits essentially as a whole.
Wow. That's pretty remarkable story. I'm a big believer in, in divine intervention, and things just happen for a reason. I mean, had you not relocated to Dallas, had you not gone on the computer that day, let me ask you a question. Where do you think, had you not done that search, had you not driven to new benefits. It's pretty amazing.
Yeah.
And walked in that door. Where do you think you would be? I mean,
yeah. No, I mean, it sounds dramatic, but I really, there are certain points I think in everybody's life, whatever it is, that I don't know. I mean, I'm not saying, I just think, relationally with my wife, people going through that it's a really, really tough thing to do.
Yeah.
If you don't have some care and some help for that, financially, right? That's another huge stress on individuals and families. Of course, now you look at inflation, everything else going on with the economy, it's only compounding that as well.
Yeah.
Medical debt. I remember getting up in the morning. I always used to wake up very early. Now I have to because my kids are 6 and 3 and they wake me up no matter what. But I always woke up early, and I would just, even to get stress relief, I'd go out in the morning. I'd wake up, real early, 5:30, 6, because I wasn't really sleeping that well anyway, and just go for a run and start thinking about this stuff. How am I going to solve these problems? But at the end of the day, you kind of realize you can't solve all those problems by yourself. That's kind of the reality I got to. So like you're saying, that could be a bad place for someone to be in. And that's how much I really do thank God. I mean, it sounds dramatic again, but everything happens for a reason, like you said. So
yeah. No, it's, there's no one, I mean, people are resilient. There are people who have overcome just incredible stresses and problems in their life. And every single part, I believe this, there's no one without some sort of mental health issue or stress, whether it be financial stress or parenting or relationship or professionally, right? At some time or another, and I think probably even more often than that, throughout life, you're a hockey guy, but I'll use life throws you curveballs.
Yeah.
Yeah. It's the hardest thing to hit.
Exactly.
And, you could swing all you want, but you get exhausted just swinging at curveballs all the time, right? You need help. You need someone. And, I know here in New York, mental health parity legislation recently, it's kind of a big win. If you have a health insurance plan with a copay type arrangement, then the mental health outpatient services are equal to the primary care doctor copay. So now it's not a specialist, which is typically a larger copay. Specialist copays could be 60, 70, 75, as high as $80 here. Maybe actually we have a $100 copay plan for specialists. So, it's going to be more like, $25, 30, 50, $60 copay. But still, that's a lot. Right. And you don't, it's very difficult to find high quality professionals, mental healthcare professionals that participate with insurance companies. It really is, whether it be outpatient, whether it be inpatient, you want some flexibility. You want to be able to, you don't need to make an appointment 2 weeks in advance necessarily. You need someone today. I'm going through something right now, and 2 weeks from now is not good enough. And that's where technology can really step in. I know we're talking a lot about mental health, and that's not the only thing, that your platform can address, and, and technology is just in general. There's so many people walking around with high deductible plans, right? Or low deductible plans. Even high quality underlying health insurance plans have limitations because there is such a shortage of primary care doctors. And let's face it, I talk about it all the time, the faults of the managed care healthcare delivery system. Doctors get paid when you see them.
Right.
I recently went for a physical. My doctor's, he's not watching the show. He's okay. He's okay. He's a businessman, right? I walk in last time. I like to do this with people. A lot of people just as a welcome just say, how you doing? Well, I always say, not always, but I like to say sometimes, oh, not great. Because you still get that, oh, good, because no one's listening.
I know. Yep.
And especially doctors. I mean, they are busy. I have all of the compassion in the world for doctors, especially primary care doctors. A lot of them work for healthcare systems these days. They have quotas that are really unsustainable.
Yeah.
Their quality of life is not that great. They went to school. They got into this profession. There's nothing wrong with getting into it for maybe financial reasons, right? There was a time when doctors really did really well, and they were regarded very highly by the communities that they serve. But more and more these days, doctors, especially primary care doctors, to spend with the patients, they need to get into that next room. I recently heard, and I wouldn't say who it was anyway, but I can't remember who it was that I was having this discussion with. It was a really serious situation, and this was an urgent care visit that someone went to. And when they got there, it was pretty serious. And, they were greeted, they were brought into the room. The nurse came in and, did the normal, blood pressure, things like that, asked what the problem was. And when the person expressed the problem, she said, "Oh, man, I really wish you hadn't come in so close to lunch,
Wow.
because that would really probably require a longer visit. But our doctor goes to lunch in 10 minutes. I'll see if I can get him in here real quick." And the doctor rushed into the room with like 4 minutes to spare. And really, and this is a true story, in 4 minutes left,
Yeah.
walked out, said, "I'm sorry, you're going to have to come back. I have to go to lunch."
Yeah.
Because he's not calling his shots. He works for someone. There's a private equity group probably that owns
Yeah.
that particular urgent care setting, and he's an employee.
He's
of
under
that.
a ton of pressure. Exactly. I feel like doctors
Tremendous
have
amount
that
of pressure.
tremendous amount of pressure. And I actually, it's funny you mentioned that. I mean, or maybe it's not funny, but I felt that too. When a doctor asks you in the actual visit, "How are you doing?" Is he or she asking, "How are you actually doing?" And let's talk about that for a while and figure it out. Or is it just like how you do it on the street and then that's it? You know what I mean? But they're under a ton of pressure. They don't have time a lot of times and all those other
They don't get
pressures.
to know you. They don't get to know you. There's a lot of things about someone's health that doctors probably really, in a perfect world, would have. And I'm going to have in the next few weeks, I'll have a great doctor who's really on a mission, Dr. Jeffrey Gold, direct primary care doctor. We're just trying to figure out a day where he can come on the show, and I'm going to ask him. Don't hold back. He's a pretty passionate guy, if you know him, and he has a lot to say on the matter, and I love that, because the passion in your voice, your story, my story, I talk about it all the time. I won't get into it now, of like why 7 years ago did I change the entire trajectory of my career, and the conversations we're having to work a lot harder to really try to convince people that you've been brainwashed, and so were we, right? We didn't have the data, but do you know Taylor Miles?
Yeah.
Taylor posted something on LinkedIn today. It was a really powerful message about mental health, and he mentioned that doctors and nurses are in the top, I think it was 5 professions with suicide and mental health issues.
Absolutely.
Doctors and nurses.
Yep.
That's a real that is a real problem that as a country we have, when we're placing that much stress and pressure on those 2 professions, where their job is to take care of the rest of us.
Yeah,
We want
exactly.
them doing well.
They're humans too. Exactly.
Yeah.
And there's also other stresses or pressures they're under where in today's environment of used to everybody, legal things and that they have to follow. And it's very hard for them to provide the care that they probably want to, in all reality, right? They probably want to be able to do this. It's just they're under so many restrictions in multiple different areas that they just can't do it. I went to the urgent care. You mentioned urgent care. I went to urgent care down here in Florida about 2 years ago. My son, we were in the mall. He was younger at the time. And I get on the escalator. I'm holding a bunch of bags. And I think I was on the phone with my wife. Smart guy, right? Anyway, get on the escalator. And my son decides to start screaming, "I'm not getting on the escalator." Well, I could have just went to the bottom and came back up. Would have been the end of the world. I just had to turn around on the phone with the bags in my hand and try to run up the escalator. And I fell and I cut my leg, like split my leg directly open down the middle. Those things are sharp. I never knew this on the escalator. And I'm thinking, what do I do? I mean, I was like gushing blood down my leg. And so I find like the mall security guy or something. And he kind of just looks at me and goes, "Oh man, that's bad." I'm like, "Okay, you're not helping." Anyway, so I make it to the urgent room, our urgent care, wait for however long I waited, get in there. And they ended up just like coming in and, speaking of time, like putting like staples in my leg, just boom, 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 boom. And later on, I talked to a physician who's actually a friend of mine. He's like, "Why didn't they like take some time and clean it up and like give you stitches? That's going to be a huge scar. Did you know that?" I'm like, "I have no idea. I just showed up and got care and left." And I do have a huge scar on my leg. But anyway, it's just that's just one minor story. But that happens every day for, I think, even more serious conditions, unfortunately.
Yeah. Well, that's HR directors. I like to categorize anybody at a company that's involved with the benefit decision as the benefit decision makers, right? The team, and hopefully it's a team, right? There's a lot of pressure on HR directors, chief of people officers, whatever the title is, that they use, that oversee the benefits, right? So they just check off, right? Medical, that's an automatic. Dental, vision, life, and AD&D, sometimes disability insurance. These are all insured products, and their medical's super important. I would put disability and life insurance ahead of vision and dental because
100%.
they don't have tremendous amount of upside, but they throw them in there, right? And they can be very costly, and utilization could be really low on vision and dental products, right? I mean, and they don't go a long way. They, your traditional PPO dental style plan is going to have anywhere from $1,000 to typically about $2,000, $2,500 maximum payable benefit if you're a large group, right? Because let's face it, you can't charge a ridiculous amount for dental. No one would take it, especially if it's contributory or voluntary benefit. But that means that people are walking around without access to more expensive dental care, right? Which is a DHMO type of dental, a dental maintenance organization, DMO, right?
Yep.
Similar to an HMO medical plan. I like those plans better because typically they don't have a dollar cash limit. It's a discount program.
Right.
You're going to get, maybe you'll get your preventative services at no cost. Maybe it'll just be a discount. The basic services, the major services. If you're a large enough company, you can, sprinkle in orthodontics coverages. But, if you have $10,000, and people do, of dental work, and you're getting $1,000 benefit, that's $9,000 you might have to avoid. Whereas, through a DHMO style plan, which is what I assume that's part of the discount, health discount benefits that you offer, is probably a DHMO that doesn't have a limit. It's just maybe it's a 25, 40, 50% discount depending on the type of service.
Exactly. 100%. So, I mean, that's a great point. And I kind of learned that when I was with Guardian as a financial advisor. I talk to people and say, the first two things you're going to look at is obviously when you're doing your fact finding is going to be disability insurance, because you can have your best financial plan and investments ever. If a disability situation occurs, your plan's ruined.
Right.
Pretty much immediately, or within a few months, most likely. Life insurance as well. But a lot of times the response I would get would be, oh, I already have that. I already have that through work. And okay, oh, that's excellent. You don't make anybody feel bad about it. That's great. Then you get the documents. They have $50,000 worth of term insurance from their employer, right?
Mm-hmm.
Or $100,000 maybe. And they're making $150,000 a year. So you can't just check boxes off in the benefits world and insurance world. You can't do that. And that's why I love working with people, honestly, like you, Lou, other, you call them boos, right? Benefit advisors that are really looking at this stuff and not just checking boxes. You mentioned dental. So most people don't even realize this. Benefit advisors, HR teams don't even realize that there are discount programs out there where you can actually basically have the Aetna PPO network or the Humana PPO network. You basically almost eliminate premiums. It's an unbelievably reduced cost, like $1 per month or something, right?
Mm-hmm.
Per employee. And you can use that as many times as necessary. There's no waiting periods. It's fine if you keep the dental insurance in place, but like you said, there's only so much that's going to cover. There's typically waiting periods, or orthodontics not even included. You're going to reach the max they're going to pay pretty quickly if you have any sort of actual dental work you need done. With non-insured benefits, you can actually come in here and have that network, and just every single time the employee or their family, because the majority of non-insured benefits include the family members no matter what, their entire family can access the dentist in the Aetna network or Humana network, and they can basically receive discounts, 15 to 50% off every single time they go to the dentist, and it's not capped, and it's for the entire family. So it doesn't matter if they're on the dental plan or not. That's just one example, but I think it's a great one of not checking boxes, of actually looking in and really enhancing these plans to make sure employees and their families.
Did you freeze up on me? I think you froze up. Oh, there you go. I think you're back.
All right.
You froze up.
Sorry.
You froze up for 2 seconds, but that's okay. I did
Okay.
that deliberately because you're a Devils fan. So I just, I thought maybe you're going to say something disparaging about the Rangers.
Yeah, you can cut me off if I do that. But no, that's a great. That was a great example. I mean, that really is, and that goes across the board. Quite frankly, is what I like to do with benefit advisors.
Oops, happened again. All right, so Brian's frozen. We'll talk about this till he comes back. So the real interesting thing to me is about Brian's solution. We don't really talk about products too much, but this is important for people. Is that this goes down to any size group. The minimum premium is $50 per month for the new benefits package. So if you're a 5-person group and you have employees with a high deductible health plan, if you have employees with no insurance, we have a lot of groups where people waive, and unfortunately, it makes me very, very sad. Is that a lot of times on the waiver forms, people have no insurance at all, and it's because of the cost of the insurance that they're not able to do it. But to the employer's credit, they're offering coverage. They're doing the best that they can. It's hard to run businesses, small businesses and large businesses alike. And sometimes it's just a matter of this is what we can do. Single premiums here in New York for companies all the way up to 100 employees, gold plans, they're $1,100-$1,200 a month for a single. If employers paying half, which a lot pay more, but if you're even paying half, which is a lot of money, that's leaving employees with $500, $550 out of their pocket. Maybe the employer is offering a silver plan that's only, $850 or $900 a single, but that's still $400 out of the pocket. And now those silver plans typically are going to have deductibles of $2,000, $3,000, $4,000. Sometimes it doesn't apply to the primary care and the specialist. Maybe it's just applicable to inpatient care, outpatient care, radiology. But again, the thing about the non-insured benefits is that they can be offered as a package. Employees can pick certain benefits. Some of them the employer might feel so passionate about that they're just going to give to everybody, and other things are there on the ready. But getting back to one of our first points, and Brian's back, so that's awesome, is how do you juggle so many vendors? And you need a technology solution, an aggregator, like Brian mentioned, who can bring this all together into a single access point. And not only just these benefits, but then a lot of the other important things related to their core insured benefits, like their ID numbers, their ID cards, maybe the summary of benefits, things like that, where the other solution or the other thing that this can address is maybe less calls to HR, maybe less handling of maybe non-essential benefit questions that are bogging down an HR team today. So welcome back. I think you caught most of that. So
yeah, no, absolutely. And I call that the power of aggregation, really. And the power of aggregation is not just essentially putting together just prepackaged turnkey packages and that's it, take it or leave it. It's basically on a group by group level, the benefit advisor and the HR team working together and saying, okay, we'll leave a younger population. We're hearing needs about this. We're seeing this in the claims and the data that you're getting, like advisors like you get, Lou. And this is where we really
Brian's wife's really struggling today, and I think that this could all be resolved if he just agrees to root for the New York Rangers for the rest of the season. But I don't know how he feels about that. If he's hearing this now, hopefully he'll be back in a second. The other things that really interest me in these type of solutions are the complementary benefits that are included at no cost whatsoever to the employees. Things like discount diabetic supplies, durable medical equipment, hearing aids, lab tests. Labs are another area where they're going to be applicable to the out-of-pocket costs of the health insurance plan in most cases. Radiology, labs, MRIs, CAT scans. You have the ability to now have some direction. You'll be able to see costs and prices up front for things like MRIs, CAT scans under any plan, gold plans, silver plans, bronze plans. These are the type of services that, too often the patient is being directed by their doctor, who typically now these days works for the health insurance system, and is being directed towards points of care where these services are overly inflated in price. They could be 2, 3, 4, as much as 5 times what Medicare would pay for these types of services. I recently, just my sister-in-law was visiting from Italy, and she saw a doctor. Nothing, super important. Important, but nothing, life, changing. But she needed a test that her doctor prescribed, and she doesn't have insurance. So it was a CAT scan of some sort, and she called up the facility and said, "Okay, I don't have insurance. What will this cost me?" And she got a quote of $600, which was actually a very good price. I knew right away, because I have access to a lot of this information. I was going to be an independent facility, and they said, "Here's an 800 number to call before you come in. Call this number. We might be able to cut half the price from the 600. So it was going to be $300, even better. But there was no guarantee of that. And I said, let's call an independent place, because it was late Friday, and the office was closed that she was going to be going back to. And I said, let's just call the independent facility that's about a mile away from where we live. And they got the cash price. And I specifically said, not the non-insurance price, which might sound like the same thing as a cash price. But I said, ask them what the cash price is here. And the price was $225 for the CAT scan that she was excited to pay $600 for. And if she had insurance, she probably would have a high deductible plan, and she could have been paying $1,000, $1,200 for that same test. So I was just talking to Brian about the complementary benefits and some of the things that are included at no cost to everybody that's within your platform, like lab tests, MRIs. What's the cashback and the deals and the travel?
Yeah, so those are benefits that are really unique. Obviously, they're not specifically health benefits, but they serve multiple purposes. Number one is obviously, so the mission of, I'll talk about new benefits for a second. The mission of non-insured benefits in general is to save families millions of dollars on their healthcare and lifestyle expenses, because those go hand in hand. I mean, so there are benefits out there like, real true discounts on travel, as an example. So benefits like discounts on hotels, rental.
Poor Brian. What's going on in Dallas with their Wi-Fi today? So Brian is frozen again, and I apologize, everybody that's out there or ends up listening, on the podcast once it goes live on our website.
Sorry.
That's okay. Is it definitely your side? Are you saying
it probably is. I'm in a brand new office literally this week, so I'm so sorry for that.
That's okay.
Must be on me. But we were just talking, I mean, discounts on hotel and travel and rental cars, because those are things, you mentioned mental health and barriers to care, and people can't wait, typically can't wait weeks to months to be able to access those mental care providers. So there are solutions like, virtual mental care, where they can schedule appointments either within 72 hours with psychiatrists and therapists, or even, like you said, programs which I like to build into the package as part of the package. At 2:00 in the morning, they need to speak to somebody, they can access that care. But if you really start thinking about it, mental health is also about families being able to get out there and spend time together and travel and do things like that as well. So they kind of go hand in hand. And there are benefits out there, like the NB travel program, where it's truly completely separate from these large aggregators of hotel rooms and things like that. It's funny, like the Expedias and Pricelines and Travelocities, oftentimes they're owned by the same big company, which is ridiculous. So you think you're getting a better price here or there. By having a membership through a non-insured benefit, you completely kind of break that out separate from that and truly get access directly to the provider of the hotel room. And you can save a ton of money on hotel rooms. And then you mentioned like the NB Deals program. So those are things like discounts on groceries, right? Even just everyday things like going to a movie theater with the family, restaurants, theme parks. So those can all be included in the benefit package at zero cost because they serve their purpose of helping save money for those individuals and families. But another important part of it is, as part of that single membership, it keeps employees and their families coming back to that membership in the app. So it kind of works like a carousel. So that's another huge component of it. And I was a huge supporter of this when we first started adding these benefits, because someone may not go to the app the first time for a mental health visit or for a telemedicine visit or for discounts on a veterinarian or for help with their caregiving situation. They may just not go there. It's not really exciting. You know what I mean? They may be in trouble. They may need help, but they may not even. But if you tell them you have discounts before they even had that need on things like travel and hotel and rental cars and movie theaters and theme parks at Disney World, they probably will go there. And then they're getting push notifications throughout the year. And it's one single membership branded. I think branding is key too. So one membership, one access point, not a million different apps, not a million different member portals, one single membership access point. They can log in using the biometrics on their phone. Done. You know what I mean? They're in. And then single sign on our SDK to all these other benefits. So they get really familiar with it, especially throughout the year. They use one benefit. Maybe they use telehealth. And they're actually getting a reminder that they have a prescription discount because that goes hand in hand. Now they see the other benefits. And over time, everything is in one single membership and everything is branded either to the employee benefit firm or even most of the time all the way down to the employer group. So it's very familiar to them. So they can access all these benefits. And what happens over time is it snowballs. Utilization gets extremely, extremely high throughout time, which is what we want. We want the individuals and families using the benefits, because if they're there and nobody's using them, they're not serving any purpose.
Yeah, I know that, utilization for me, right? I really don't like the term return on investment, right? You're making an investment in your people, of course, when you do something like this, but typically utilization when you roll these type of programs out individually are very, very low, and it's because there's not that familiarity. You don't remember when you need it the most that it was there, and then you find out, shoot, I could have used this, and it's happened to me. I've had some of these types of programs, in the past, and forgot that I did. Because I'm in the business, the different vendors will sometimes give it to us to test out complimentary type of, information or access. But because of these other complimentary benefits, the shopping type deals, I'm guessing, right? Like, as you mentioned, people will go there. People like to shop. I talk about employees and patients. I call them the American healthcare consumer. Right. Employers are also the American healthcare consumer, although I argue that they really think of themselves as insurance consumers. They're purchasing insurance. And, those for most of my other conversations, I want to change that mindset. You are not buying insurance.
Insurance is catastrophic. I mean, you know better than I do, but I consider it's supposed to be catastrophic. It's supposed to be it's not supposed to be for literal everyday care. I mean, it's just, it's not.
Well, you're shifting risk, right? When you buy insurance, you're shifting the risk. But the risk in this case, for what I do primarily, is healthcare, right? Healthcare. Right. And you're financing it with insurance. And there's a lot of different ways of doing that. But because people have, been so focused on managed care and all of the, the things that were true about managed care 25, 30 years ago aren't true today. You're not getting discounts any longer. You're just not, right? You are not getting the best prices for prescriptions. The contracts are extremely complex. Most people don't even ever see their contract. They see an application. No one's reading a certificate booklet or a health insurance contract. But in that contract, is language that's really working against employers and their employees. And that's one thing I'm really passionate of trying to get that message across is if you believe that you're buying access to healthcare for your employees and their family members, then we should have a conversation because we'll show you where the traditional approach to that falls short, where you're overpaying, the hidden costs, the artificial prices that are really plaguing employer-sponsored health insurance plans throughout the country. And then the simple strategies and solutions that we can make over time, doesn't have to be super disruptive in year one. This is slow and steady. First step is getting the data. And what the data shows us is there's a lot of shortcomings, which is what the benefits within your package are a lot of the areas where the traditional plans fall short, right? And adding stresses to people, not alleviating those stresses. You have a couple of major vendors. I won't mention names. It's really not a sales platform here to talk about, but major telehealth vendors. A couple of them. You have some major ID theft vendors. I'll tell everybody right now, I'm going to be doing this for my office. We have a small team here, but I'll be saving money because I know what I pay for identity theft, for example, and I don't know my password when I need it the most. When I get that email saying that there's been an issue with your credit or your social or emails or your passwords, I can't remember at that moment to get into my thing. And now the rest of the day, I'm stressing out, thinking, "Oh my goodness, what's going on here? Why am I getting? Is this even real? Right? Is this thing real?" I laughed when I saw it. Pet telehealth, because I tried to have a conversation with my Shipu Duncan last night about this. And he's excited about it, but he has some reservations of how this is going to work. So can you tell me how this works? Pet telehealth.
Yeah, absolutely. It's not a Lassie situation, so the dogs aren't going to be speaking directly to the doctors and veterinarians. I'll clear that up right up front. So that's not what it is. Although that would be pretty cool. Maybe a good show like Lassie. But look, I think it's important to work with vendors or aggregators that are very quick to be researching these new non-insured products, but also a little bit slower to roll them out. And that's something people don't understand is, and rightly so, it's not their focus. Pet telehealth has been around for almost a decade, right?
Really?
It takes time for these things to make sense. And also sometimes it's just the marketplace isn't ready to utilize it, right? But now is that time. I will tell you that it's just that time. I think COVID, obviously with general mental health, things have been going more virtual, obviously Zoom calls, everything like that. That has pushed a lot of telehealth in general. And it's spewed over into the pet world. People love their pets. And I was a little bit hesitant about it at first as well, but I've used it myself now, believe it or not. What I'm seeing is, like I mentioned earlier, veterinarian bills are a huge burden on people that have pets, right? A huge burden on them financially because they want to take care of their pets. And then most of the time they will spend whatever it takes to take care of their pet, right? And sometimes that can be tens of thousands of dollars. So giving them access to discounts, I think, in person to be able to access a network of veterinarians where they could go see the vet in person, because that's still going to be needed, right? That's an important piece of the pet telehealth. So I like to put those two together, or recommend that at least, where I can go to the vet and actually save about 25% off of every veterinarian visit. So that's huge savings to the family right there. But there's a ton of things like allergies, and my dog has skin allergies all the time. Where do I really need, if I call the vet, they're going to tell me to come in, schedule an appointment within, can you come in next Wednesday or the following Wednesday at 11 o'clock? That's the only time we have. No, I can't. You know what I mean? I have other things going on. I'm working. I have family, right? So the same principles that apply to virtual care and for humans actually does apply to pets, and it does save individuals and families a ton of time and money by not going to the vet, not paying those huge bills when they don't have to. At least start there. We put a $0 consult fee on that as well, just like we do in the other areas. There's no risk to calling a veterinarian, even at 2 o'clock in the morning. Call them. You know what I mean? Don't take your dog to the emergency room for pets, right, and pay that bill. It's the same concept. So really a unique place. But another benefit I will mention that does get people coming back to the membership drastically. So in a good way. So it keeps people coming back to that membership. They love their pets. Maybe they don't have a need for themselves or their family. They come back to the membership, they use it for the pet, and then they understand, oh, wait, that's right, I have this other benefit. And they keep it, that's another way to just keep spiraling the utilization throughout the year.
Well, veterinarians get paid, similar to, medical doctors. They get paid when people see them, right? So if you have, listen, my dog's my buddy, right? He's my shadow. I should have called him Shadow. Now I understand why was such a popular dog name for many, many years. But
literally my dog's name growing up, by the way, New York Shadow.
Yeah. So, because they're just at your side, right? The love they pour into you, and it's hard not to return that. And when they're not feeling well, or there's some symptoms, you have some choices. You can, a lot of times, can't get into the vet, which is what you mentioned. So now you're forced to take your pet to the animal hospital,
right?
Which, forget about vet bills, animal hospital bills are even that much more. And we were lucky. A few years ago, my dog had a back problem just out of nowhere. 7 years old at the time, and out of nowhere was in, really, really serious pain. It was actually his birthday, so it was September 5th of probably 22, if I had to guess. Could have been, I think it was 22. Could have been 21. And during COVID, which made things even that much more difficult. But we couldn't touch him, and he was in real bad. I couldn't walk, nothing, out of nowhere. So we brought him to the pet hospital, and we sat there for hours, my wife and I, 5 to 6 hours, because there was one vet on call that day, and they were packed. And then another vet showed up, and then pretty quickly came out and examined Duncan, and miraculously, like, Duncan seemed okay in that moment. But he said, listen, I know that there's something going on. We have two choices. We can bring him inside, and we can give him anesthesia, put him out. We can do an MRI. We can have a neurological test done on him, and it's going to cost you about $8,000.
Right.
Or you can bring him home, let him rest for a few days. We think it's probably a herniation in his back, maybe from jumping on or off something. And you can see how it goes. And they gave us a painkiller and things of that nature. So we chose that option instead of jumping into the 8,000. But I was close. If my wife wasn't there, he would have been in the MRI for sure. What we did do, and what we've been doing ever since, is we got rid of our sleigh bed that was really high off the ground. And we put our mattress in the living room and slept in the living room with Duncan for 3 months.
That's amazing.
Just to the extent that people love their animals.
Absolutely. That's an amazing story, by the way. And that's it's absolutely true. My brother's actually in the dog training business. He has about 20 dogs at his place out in New Jersey at a time. So my family loves dogs as well, but that's what we see. And I think that goes into customization for each group, by the way, because believe it or not, even for pet benefits, right? There are some groups that we service where it's like, it's known. The pets come to the office, like they bring them to the company events, like they're a pet employer group almost. Like
they're here in this office.
There you go, exactly. And you just know, and that's going to be maybe an employer paid. Like that's a unbelievable benefit to provide for a group like that. Other times, maybe it's a voluntary buy-up benefit. So being able to fully flexible, being fully flexible in the non-insurance world is something else I would recommend.
Sure.
Not just having like one turnkey package that is put in place, set it and forget it. That's not the way to go. So the way to go, if possible, is to be able to fully put together flexible and customizable benefit packages based on the specific needs of each one of your groups. Pet telehealth may make absolutely zero sense for one group, and it may be the best thing since sliced bread for the next group servicing. And that's the same for all benefit categories in the non-insured benefit space as well.
So we had a couple minutes left, and I wanted to just talk about this, because it's really, really something that ties into what we do here is navigation support, like advocacy on the medical side, right? Similar to what we were just talking about with the pet. One of the things that eludes most employers and most patients, members, is where can we go for care, Where's the best place? What's it going to cost us? I mean, there's a lot of transparency legislation, but it's not really trickling down far enough to the members. Most people still today are not aware of what the cost of that test or that exam or that surgery is going to be before they have it, because they don't know that they have rights now as patients, right? And we're real passionate about that. So you talk to me about a little bit about that advocacy, and maybe if there is navigation guidance for patients.
Yeah, 100%. So, I mean, I think it's important to understand that eliminating barriers there as well. So work with a program that's going to be an advocacy and transparency solution that's going to be able to load in whatever the benefits are beforehand if possible. That's number one. So load them into the system. When the employee calls in, they already know what plan they have, what benefits they have in place. They don't have to go trying to find their documents anywhere or figure out what they have. That's the first thing. The other thing I would say is, it's much more than just calling the 800 number on the insurance plan and saying, I need to find a primary care doctor. They're not going to steer you in the direction of best quality doctors for the best quality cost with the specific board certifications you're looking for, with the amount of years of experience you want in your doctor, if you want to see a male or a female. I mean, it goes so far down. If they refer out to expensive specialists, all that data is out there, right? So by utilizing these advocacy and transparency companies and then putting it together in a package where employees are notified about it and they actually know they have access to these, call them health pros or advocates, right? That's how you really can actually steer and guide the healthcare experience in the most cost-effective and quality direction. So I think another key is the ability to call in and speak to the advocate, right, over the phone, and the ability, believe it or not, people like to do things sometimes themselves now with technology. The ability to have a pricing transparency tool where they actually have their plan in the system already loaded in, whatever their benefits are, and they can actually search right now in Sarasota, Florida. I can search for primary care physicians in my area based on all those criteria I just mentioned, and be able to find those doctors. And a lot of these vendors will be able to pull up a list. Here are the doctors we recommend based on your specific information and your request. And the really interesting thing is a lot of them will show, here are the doctors we don't recommend, and here's why. And if you want to have some fun, or you can look at those as well.
It's as important to avoid those as
That's right.
it is to try to get to the best one, right? I mean, there's just nightmare stories that we hear all the time at the conferences that I go to. There's so many passionate people that are helping the consumer in so many incredible ways, right? Just breaking down all the barriers, making sure people get to the highest value care, making sure that people are making informed decisions. There's no price I wouldn't pay to get my loved ones to the best doctor.
Right.
Even if I had to mortgage my home, there really isn't. I mean, talk about the way I love my dog, just expand that 100 times, for my loved ones. And it's difficult. It's difficult even when you're in the industry, even when you have know-how. It could be very difficult. And on the flip side, why is that also very important? If you as an employer are a large enough group where you're experience rated, or maybe you're self-insured, the claims matter, right? The cost of the medical claims, the cost of the pharmacy claims matter, right? It drives future prices. What you're paying this year is going to impact what your costs are going to be next year on those plans, right? Your fully insured premium is going to go up based on your loss ratio and all of those things. So now if you have the power of getting your members to the best doctors that are less likely to perform unnecessary surgeries or prescribe unnecessary opioids or specialty medications, right? That are have better results, right? So if you do need surgery, you want to be with a surgeon who has the best outcomes, right? Least amount of readmissions and infections and all of those things. Technology is such a huge force, but I have some access to information. But with these advocacy companies, that's their business. They have the data. I won't mention names, but there's a few that we work with that have access to 80% of all of the claims in this entire country.
Yep.
and then they aggregate that data, or they take that data and they put it through their systems, and they're using 253 different points of information where other companies might be using 40.
That's right.
Talk about
Absolutely right.
powerful. Getting
Yep.
people to the best doctors, to me, is something that really we want to be able to do for every one of our clients. And again, one of the reasons why I was so excited after, I mean, we've met a couple times and we really hadn't talked business yet, just at some conferences. But one of the things that's so amazing is that you can do this down to a 2-person group. I mean, $50 per month is just amazing. And I really applaud your team for addressing that, need. We're not here to serve enterprise companies. Not that we would turn them down, but that's not necessarily our niche. But companies with 100, 200, 300, 400 employers, they need to be able to have the same sort of resources that really large companies do. And you've been able to bring a real impressive portfolio of different companies all together. And it's we're really excited about this. We plan on I'll ask you live. We're planning on having some webinars for our clients and prospects. We'd love to have you on, talking more specifically about this actual platform. So we're right at the hour. I just wanted to give you an opportunity to tell people how they can contact you if they're interested. Where can they find you?
Yeah, sure, absolutely. So you can find me on LinkedIn, obviously, Brian Del Savio. My email is my first initial and my last name with no space at newbenefits.com. So B Del Savio at newbenefits.com. If you want to call me directly, I'll just give you my cell phone number. It's 845-826-2677. So, and I like to give my cell phone number out because family is important. I'm not going to get in the way of that. But based on my story from the beginning, I'm passionate about this. So you'll find when you work with me, and Lou, I hope you find it as well.
Yeah.
I'm here as much as possible to help. And that $50 a month, by the way, just know if that's what you're paying somewhere else, don't pay that. That Lou is talking about the minimum invoice to the group. The actual TEPM cost for each employee, when you bundle these benefits together, is drastically reduced as well.
Oh yeah, no, that's what I'm talking about. The invoice to total invoice premium. That's
just the minimum. That's the minimum to the group. So if they have at least 5 employees, they're typically paying way less than that per employee per month, essentially.
Yeah. No, that's great. That's fantastic. Well, thank you, and I know you'll agree with me that we hope that the New York Rangers win the Stanley Cup this year. We're very excited about it. I'll actually invite you over for Game 7 if it has to go that far. So
that would be an interesting podcast. We should do that live.
Absolutely. Well, thank you so much, my friend. Have a great day. Enjoy the beautiful weather down there, and I will talk to you soon.
Thanks, Lou. Thanks so much.
Thank you. Take care. Bye, everybody.